Good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Today is the 23rd day of May 2021. Today is Sunday, and today is our popular maternal and child health open clinic. Thank you so much and welcome to today's clinic. Please, when you come in, just quickly introduce yourself. Importantly, please introduce your location. I'm currently located in Tampa, Florida. I'm the convener of this group, and today's clinic is very important. Today's clinic, we're going to look at womb rupture or uterine rupture and the fate of that particular pregnancy and the subsequent fate on your subsequent pregnancies. Very, very important, especially if you're currently pregnant and you don't know the possibility that you can actually have womb rupture. This particular clinic is going to help you. There are also some other risk factors which you need to be conversant with. Number one, if you've ever had any surgical procedure in your womb, you have a risk factor for womb rupture. So very important topic. Womb rupture is not common. It's rare, but when it happens, it's an emergency we need to understand. It's an emergency we need to deal with, and we need to do it almost immediately, because if we don't do it right, we can lose the baby, we can lose the mother. So today's topic is very important to currently pregnant women, or women that are going to become pregnant, or women that have had myomectomy. Myomectomy is the surgical removal of your fibroids, or if you've had cesarean section in the past, CS. So there are a couple of risk factors that can predispose you towards having womb rupture or uterine rupture. It's an emergency. So please, when you come in, introduce yourself, tell me who you are, also focus on the admin. Remember how we normally introduce ourselves, right? So I want you to introduce yourself exactly the way you are. Let me give you an example. My name is Dr. Chudi Ufondu. I'm the convener of this group by the grace of God. I'm the father of Chizara Ufondu. I'm the father of Chidumeje Ufondu. And I'm also the husband of Chinyelu Ufondu. Now, this is my family. This is my story. This is who I am. Now, I want you to do the same. So introduce yourself. Tell me exactly the composition of your family right now. So it's possible you have your family with you right now, right? I want to know their names. It's possible your families are not yet with you now, but you know their names. So whether you have your babies right now, or you're pregnant, or you're in believing for baby category, please introduce yourself properly. It's called faith. So I want everybody in attendance to introduce themselves, starting from Kene. Kene, immediately you join, introduce yourself. Today actually happens to be Kene's third daughter's birthday, Ugo. So let's say a prayer for Ugo, amazing daughter of Kene. Kene has 3 girls, amazing, kids. Actually, so many of them are gonna go through the route of medical direction. So we have a budding medical doctor from Kene's family. But today is the third daughter's birthday. So let's extend a hand of fellowship and pray for Ugo Umaso today, special day. We love celebrating our own people, okay? But when you're coming, please quickly introduce yourself. Tell me your location. Your location is very important because I want to make sure you have enough resources in your location. If you don't have enough resources, we can see how we can set things up. So what do I mean by resources? If you have a need to see a fertility specialist, to see a gynecologist, and you're in Nnewi, if you're under me, what am I going to do? I'm going to make sure you see the best. I'm going to make sure I refer you to a provider I can communicate with. I want to make sure I can refer you to a provider that will treat you like a normal person, a provider that will tell you about your problems, a provider that will provide you with your medical report, a provider that will give you a game plan, a provider that has evidence. So it's important, okay? So when you come in, introduce yourself. Once you're done introducing yourself, we're going to open the clinic. Today we're talking about womb rupture or uterine rupture. Very important. The next 30 minutes, you're going to learn a lot of things. Then you're going to have an opportunity to know what to do. Okay? Now, I have a couple of people in attendance, so thank you for coming. Remember, when you come in, introduce yourself the proper way. It's possible you're single right now, right? But you already know the names of your babies. You know the number of babies you want to have. Like on Sunday, a week today, we are going to have our multiple pregnancy roundtable. 3 people are going to be in the panel. I will be there. Dr. Zirim is going to be there. Dr. Zirim is an amazing doctor trained in Nigeria, practicing in America here. Then Dr. Ndiche, who you guys also know is a consultant for this group. 3 of us are going to come to teach you guys everything you need to know about having 2 babies, 3 babies, 4 babies at a sitting. So many people want to have this. You can have this. At the end of this year, you can actually be pregnant and you're expecting twins. You can actually be pregnant and you're expecting triplets. You can actually be pregnant and you're expecting 4 babies at a sitting. Even if you don't have a family history, it's possible. Any woman at any time can conceive and have twins and have triplets and have quadruplets. You need to know how. In life, when you know how, you can take better decisions to end infertility. But today we're talking about womb rupture, and I'm going to start. You see, the womb is a very special organ. Matter of fact, in the whole body, the womb is the strongest of all organs. So it's expected that when you're pregnant, your womb is supposed to be healthy. Now, prior to pregnancy, for you to even achieve pregnancy to start with, the cover of your womb, which is called the endometrium, must have a particular thickness. Now, the thickness of your womb is under the control of 2 hormones, estrogen and progesterone. These are the maintaining hormone, which makes sure that you have adequate thickness so that by the time the fertilized egg, remember when the egg is fertilized, it now ceases to be the egg. It's called the embryo. So when fertilization is done in the tube, in the ampulla, it will begin the downward journey to start building, to start developing in the endometrium. Endometrium is the cover of your womb. Now, if you don't have adequate thickness of your endometrium, that pregnancy will likely not succeed. Now, some women can actually test positive for pregnancy, then over time they can miscarry. So if you have thin endometrium, the possibility that that pregnancy is going to succeed is limited. Now, your womb is very, very important. For your womb to sustain the growth of your baby for the whole 9 months, it must be within a very good state of health. There are a couple of things that can affect the ability of you to carry your baby to term, right? Now, your knowledge, your practices, your attitude, what you decide to do. One of the top risk factors that might predispose a woman to have womb rupture is previous medical history, previous surgical history. So the commonest place we see womb rupture are in women that previously had myomectomy, are in women that previously had CS, but they are now coming for what we call VBAC. So some women can still have vaginal birth after CS. It's called VBAC, vaginal birth after CS. The only criteria that will decide how you're going to deliver is the progress of that pregnancy, is the position of your baby and your medical history. So if you have very favorable medical history and your baby is coming with head and we don't have any problems, we can allow you to go into labor. Now, for women that have had CS or myomectomy, and the integrity of the womb is compromised. So what do I mean by integrity of the womb? Your womb is no longer strong as it used to be. Your womb is already weakened. This is the basis why we don't encourage women to go for more than 3 CS in this group. Womb rupture is one of the topmost medical emergencies that can kill a woman. You can be watching a woman, the woman will be bleeding to death on the table in your own face. Now, some women that can survive womb rupture, we might end up removing their womb through the process of either partial or total hysterectomy. So it's something we can prevent ahead of time. So if you currently have CS in the past, or if you've had myomectomy, remember that your CS and your myomectomy are practically the same. There is no difference. The only difference is the fact that when we open your womb, if we are doing the surgery for fibroids, we are bringing out fibroids. That fibroid can be intramural, it can be submucosal, or it can be subserosal, right? But if you're getting for CS, when we open your womb, we are bringing out a baby. Now, there are different types of CS. There are classical CS, there are midline incision, there are transverse incision, depending on the indication that led to that CS. It's always safer to play subsequent pregnancies on the line of CS. So what do I mean? If you have ever had any surgical process in your womb, the safest place, the safest route, the safest option of delivery is another CS. Unfortunately, some women will be insisting on having vaginal birth when it's not favorable. They will be quoting the Hebrew, they will be quoting Bible. The woman is in that place dying. What do you gain when you lose your baby and you lose your life? Because you don't understand. You know, today is Sunday, right? You went to church. One of the favorite Bible verses is people perish because of lack of knowledge. You can't be in this group and you don't have knowledge. The ultimate aim of all pregnancies is to have your baby alive, regardless of the route. So a woman can have vaginal birth, a woman can have induced labor, a woman can have supportive labor or augmented labor, or a woman can go for CS. They are all normal. You know, I don't know how to put this, but they are all equal and opposite. So the fact you didn't have vaginal birth doesn't make you less a mother, doesn't make you less a woman. The reason why you had vaginal birth is because vaginal birth is favorable. The reason why you're going for CS is because CS is considered favorable, because if you go for vaginal birth, the possibility you will lose your baby or lose your life is very high. So whatever game plan, whatever delivery method your provider gives you, please take it and pray that your baby will be fine, you will be fine. So every woman in the 12th trimester of pregnancy must have a delivery plan. And this is the reason why you need to start your ANC on time. Why is it important you go for your ANC? Because when you go for ANC, we are monitoring the baby, we are monitoring you. Excuse me. One of the cardinal things we check in regards to the baby is the heartbeat, the liquor volume, and the other activities, developmentally, position of your baby. So if your baby is coming with head, which we call cephalic, and we have adequate water, and the heartbeat is there, we are not worried. But women that have womb rupture, what happens when you have womb rupture? Your womb will break down. When your womb breaks down, your baby is going to escape from your womb and enter the abdomen. It's something that can lead to excessive bleeding that you can never quantify. It happens so fast that if we don't pick it up, if we don't begin to take the woman to the theater, we can lose the baby, we can lose the woman. So when you have womb rupture, your womb is going to break down. Most womb ruptures will happen in the weakest point in the womb. When your womb breaks down, your baby will escape from your womb and go into the abdomen, and your baby is not supposed to be in the abdomen. So when your baby goes to a place where your baby is not properly taken care of, one of the first symptoms of diagnosing a woman that might likely womb rupture is what we call bradycardia. So the heartbeat will start dropping, and over time we will cease to hear the heartbeat of the baby. This is the reason why any woman having any problems, once you get to the hospital, what do? We confirm that baby is okay. For every woman pregnant in their 12th trimester, you have to have a personal relationship with your baby. You have to know when your baby is in a good place. You have to know when your baby is distressed. One of those ways of knowing it is what we call quickening. Your baby will be kicking. You'll be feeling the flutters of your baby. It's expected that once you reach about 25 weeks, your baby will start giving you signs. You know, there are different characteristics for different babies. Some babies love to sleep in the night and stay up the whole day. But you should know when your baby is in a good place. It's called motherly instinct. So if you suspect that your baby is not in a good place, what do? You don't ask your mother. You don't ask your mother-in-law. You don't ask your friend. You don't call your pastor. If you're calling your pastor, you're asking your pastor to pray for you. Who do you call? Your doctor. When you call your doctor, you begin to make yourself available to your doctor's office so we can confirm that your baby is okay. Unfortunately, some women can be carrying dead babies in their belly, but they don't even know. The most painful thing that will happen to a pregnant woman is to be waiting to go into labor to deliver a dead baby. It's very heartbreaking. Unfortunately, it happens. But things we can prevent, we prevent them. So womb rupture is something that will scare the hell out of you and make you to be compliant. Some of the problems we might have in life is based on our practices. It's based on what we think we know. In pregnancy, 9 months is a lot of time. A lot of things can happen. There are even certain things we can't even decipher. There are certain diagnoses we can't even make. There are some babies that their mothers will be waiting for vaginal delivery, and we go for emergency and we discover they have cord tie. The cord is completely tied on the neck of the baby, that if we didn't go for cesarean section, the baby would die. So there are so many things going on in the body of a woman, in the belly, that we don't understand. So doctors have limitation, but doctors are God's angel in the world to save babies. And what you do when you're pregnant will determine the outcome of your pregnancy. So the very first thing you can do to safeguard your baby is to do what? To register for ANC, so that if we notice anything problematic, we can begin to intervene on time. Time is very important in pregnancy. So the moment you are confirmed pregnant, please make it a point of duty to register for ANC on time. When you register for ANC, you attend all ANC appointments. When you notice certain things not okay with your body, you call your doctor. When you see blood, you call your doctor. When you see water coming out of your body, you call your doctor. When you have pain, you call your doctor. When you bleed, you call your doctor, because womb breakdown can present differently. Some people will present classically with the pain, with that excruciating pain, and when we go in, we see the blood. And if we don't act on time, we can lose the woman, because once your baby leaves the womb and enters the abdomen, the baby is in danger. The intervention of womb rupture is to save the baby. So once we diagnose that a woman has ruptured her womb, what do? We go in immediately, emergency CS, bring the baby out, and begin to see if we can save the womb. Unfortunately, some women might die. Unfortunately, the ones that will survive, we might need to remove the womb. And when we remove your womb, you can still be a mother, but you cannot carry your baby. So long as your ovaries are okay, you can still be a mother, but once your womb is compromised, you need a surrogate mother. So this is a very serious business. So stop insisting on having vaginal birth, on delivering like Hebrew women, when vaginal birth is not favorable. There is nothing wrong in going for CS. And please, when you have had 3 CS, consider stopping. It's not a competition. You are not putting the number of babies you have with your friends to know who is better. We don't compare with people. Whatever you have, God gave you. Be happy where you find yourself. Don't go trying to be like other people. Don't go trying to envy them, and you kill yourself. If you have to take good care of 2 babies, take good care of 2 babies. If you have done 3 CS, please stop. The 4th one might put you in danger. It's important. Very, very important. Okay, so that's a quick overview of womb rupture. Now, what I'm going to do is to give us a chance to ask our questions. In the next about 10 minutes, I might likely give more extra, minutes, because it's weekend, but ordinarily in 30 minutes, I'm done. So globally, every year, millions of women deliver their babies successfully. However, some might not have smooth delivery. So womb rupture is one of the complications we can have in pregnancy. And it's something that must be taken very, very serious. It's catastrophic. It can damage the mothers. It can kill the mother. It can kill the baby. It can lead to excessive bleeding. We need to make sure we do the right things immediately. Very, very important. You cannot afford to miss this. Management is mostly surgery. Once we notice you have this, we take you in, we begin to see if we can save your life. You see, in life is more important. So when you have problems in your pregnancy, we are focusing on the woman. There are some pregnancies we have to terminate. If the baby is going to put your life in danger to kill you, what do? We terminate the pregnancy to save the woman, because if you survive, you can still have another baby. But if you die, your baby is not going to be there, you're not going to be there. So it's important that the woman is very, very careful, so that even if unfortunately you lose your baby, we can save you so you can have an opportunity to become a mother. Very important. So the clinic is going to open now, and I'm going to take care of your questions. Now remember, on the 30th, which is Sunday, we are going to have multiple pregnancy roundtable. Multiple pregnancy roundtable is going to be an opportunity for you to learn everything about twins, about triplets, about quadruplets, your chances, how you can achieve it. If you want to do it naturally, if you want to do it artificially, what can you do? Especially if you are above 35, you have an advantage, both naturally and artificially. Why? Because as a woman is getting older, she has a possibility of losing more than one egg. She has a possibility of one egg dividing and yielding identical people. So you have a better advantage of multiple pregnancy if you're older. So in the same vein, if you have been looking for a baby for a long time, you can suddenly have 2. You can suddenly have 3. You can suddenly have 4. So from no baby to 4 babies, what are you going to do? You're going to go for BTL. It has happened before. 2018, a lady came in with 1 2. She mustered up courage. I encouraged her to go and borrow money from her bank. She got money. She got loan. Today, she's a mother of 4, 2 boys and 2 girls. Just like magic. You can be the same, but you need to take your bold steps. Let me tell you the truth. Every single time I show up, I want to help. Now, when you have said your prayer, when I share a post, when I share a testimony, and you go there and you congratulate that lady and you say amen, don't stop at amen. Make sure you're doing your part. Make sure you're making love. Make sure you're consulting a doctor. Make sure you're making yourself available. There are some people that could have completed their family by simply going for IUI. There are some people that could have completed their family by simply going for IVF, especially if age is not on your side. Some women were dilly-dallying around IVF 10 years ago. Now they are ready, but they no longer have eggs. Don't let that be you. If you know what the problem is, begin to follow it. You're praying about it. You're praying for the doctors that will take care of you. You're taking your own actions. If I tell you to go for IUI, begin to go for IUI. If I tell you to go for IVF, begin to go for IVF. If you're going for IVF and we discover you have challenges, please yield. You don't gain anything using the whole of 2021 to experiment. There is no room for experiment. You have to have a result. You have to be a mother at 2022. You cannot continue to be showing up in our group as somebody looking for a baby. No, this is your year. So I challenge you to step up and go for your IVF. Some of you might need to borrow money. It's okay. If you're a loving person, if you're a caring person, you will find the money you need. The biggest investment you need in your life is to start your family. Babies do not have price tag. So if God blessed you by giving you the resources, don't go and put it in the bank. Don't go and buy houses. Don't go and buy cars when you can use your money to start your family. Some people will want to have all the money in the world so they can go for IVF. But some people have all the money in the world, but they are not going for IVF. They're going to places that people will confuse them. This is your opportunity to end infertility, and it's possible in this group. You use your knowledge and you end infertility today. If you need to go for IVF, go for IVF. There are so many of you that your doctors have already told what to do, but you keep denying it. You keep binding it. Oh, it's not my portion. IVF is not my portion, but that's the only route that God is going to use to bless you. You cannot bind and cast the only pathway that God is allowing you to become a mother. There are some people that will go through IUI, unfortunately. There are some people that will go through IVF. There are some people that will go for surrogacy. There are some people that need to adopt. There are some people that will have blended family. You adopted, you have natural baby, you went for IVF, you went for IUI. Whichever one you need, go and do it while you still can. Okay, so now I'm going to take care of your questions. Someone is complaining about the audio. If you are not hearing me, I'm practically shouting. You can see I'm also sweating. But hopefully check your audio and please go ahead and ask your questions. So the clinic is going to open now. Admin, if I missed any question, please post it back so I can provide feedbacks. Guys, ask your questions now. Okay, the clinic is open. Let me see what I have. Okay. How can you register? Follow the admin. Admin is sharing all the links. Okay. So the first question says, hold on, let me go here. Okay, I can't see the question again. Okay. Please, how can you register? Follow the admin. Admin is sharing all the links. All you need to do is to click on the link. Depending on where you're located, you click on the link, follow the instructions, send us email. We're going to put you in the group. That's the best way to follow. We have only 100 slots. Once the slots are done, we're going to close registration. So this is the opportunity. Okay, so guys, ask your questions. I'm still looking for questions. Where are the questions? Okay, thank you. Please, your friend had IVF. She started bleeding from day 7. The hospital said it's normal. She took her pregnancy test 2 weeks. It came out negative. She's still bleeding, not heavy bleeding. Well, it's not unusual to have spotting, if it's successful. That spotting might be implantation bleeding. Then that bleeding might also be a complication. Unfortunately, after 2 weeks, after 14 days following embryo transfer, that's the likely period that when you go for pregnancy test, you will get positive test. Unfortunately, some people will not get pregnancy positive, unfortunately. So what your friend needs to do, communicate with that hospital. They will tell her to stop taking all the drugs immediately. Okay, so that bleeding can be anything. It can be reactions, it can be infections, it can be anything. And there are so many things that can lead to failure of IVF, so many things. This is why you need to be careful. Now, I expect your friend to go back to this doctor and have meaningful conversation. And if it's a good doctor, the doctor is going to investigate. They're going to give her a report. So anytime you're spending a lot of money, not even a lot of money, because look, anytime you're going for any service, you demand to know, you need to know your report. It's your right. So tell your friend to go back to that provider with the partner. Make sure anytime you have anything important, go with your partner. The doctor needs to explain to you guys what happened and possibly investigate. Okay, that's what they need to do. But unfortunately, your friend is not pregnant. Unfortunately, but your friend can be pregnant if we go back to the drawing board and see if we can correct certain things we notice that might be wrong. The problem can be the egg. The problem can be the sperm. The problem can be implantation. The problem can be infection. It can be hormonal. It can be anything. But we need to know so we can do it better. Unfortunately, some IVF providers do not even give you a report, and they will tell you, "Oh, don't worry, we have remaining eggs. Come back and we'll give you discount." That doesn't make sense. I don't approve that. When you're done with anything, good, bad, let them give you a report. So that if you're under me, you present the report, we're going to review, and I'm going to tell you my mind. One thing you can get from me, I will tell you the truth. Sometimes the truth will be very bitter, but it's still the truth because that's what you need. I will personally not love giving you false hopes. Let me give you an example. Your tubes are blocked, or you had a ectopic pregnancy. They cut off your 2 tubes. Then you come to me as a Christian. We are both Christians, right? Now, what's the right thing to do? I will tell you, my sister, you have salpingectomy. We have removed your tubes. That's the reality. And God is still God. Then what do we need to do? We are going to check your ovaries. If you still have good ovarian reserve, you can still be a mother. But my sister, you cannot succeed in becoming pregnant naturally because your tubes are gone. But you can become pregnant through IVF. This is the right way to deal with people you love. Not telling them stories, not telling them to come, let's flush your tube, when you know fully well that the tube is completely blocked and you're taking their money. Let me give you the truth. Any doctor, anybody preying on people that are looking for babies without giving them correspondence, but it doesn't make sense. If you see any woman looking for babies, please go above and beyond to give her the best. Don't give her false hopes. Unfortunately, some women will egg on the doctors. Some women will know that their eggs are not of good quality, but they will insist, "Doc, I know my family. My husband said this, my husband that." Then some doctors will reluctantly use an egg that will fail even before you start. I won't do that to you. I will tell you your truth. You can cry. It will be painful. Both of us sometimes can cry together, but after that, we need to do the best thing for us. So long as you are a woman, you can be a mother. You might not be a mother through the natural means, but you can still be a mother through IUI, but you can still be a mother through IVF, you can still go for surrogacy, and you can still adopt. Adoption is also motherhood. There is nothing wrong with it. But I can't tell you lies. I can't mislead you because it's painful. You can be my sister, you can be my brother, you can be my uncle or an auntie. I don't want to waste your time. I owe you the truth. So it's important to have all this meaningful conversation. Okay, guys, ask your questions. My time is actually up, but I'm going to probably put in another 15 minutes. Okay, another 15 minutes. What's IUI? IUI stands for intrauterine insemination or artificial insemination. So most couples that will go for IUI are couples that likely have sperm problems. So the partner might have low sperm count, poor motility, poor morphology. So what do? We are going to check the guy's sperm, and we are going to make sure we have some good sperm. We are going to wash the sperm, put it in a special catheter, then introduce it directly into the womb. So we are going to tell the penis, you know what? Penis, you're not doing a good job. You are on suspension. We are going to take over the function of the penis. We're going to collect the sperm. We're going to put it in a special catheter. We're going to make sure that the woman is ovulating. We're going to make sure that at least one of our tubes is open. Then we'll introduce the sperm directly into the womb. Once the sperm gets to the womb and the tubes are open and the sperm is good, the sperm will begin to swim to the side of the tube where it will meet the egg. That's called IUI. Okay? Can turning on the bed hurt the baby or cause the cord to coil on the baby's neck? Completely no correlation. There are different layers of your belly. There are different layers of your womb. Your baby is safely developing in your amniotic sac with the fluid. Completely not related. But here is the deal. Please, if you're pregnant, don't lie on your back. The rightful position to lie on is on the left side. When you are pregnant and you're lying on your back, you are practically drowning in your own blood because there is a very big vessel that actually supplies blood to the whole body, and the pregnant belly can impinge on it. So it will look like you're swallowing and you're drowning in your own blood. You don't do that. Lying on your back during pregnancy is completely not approved. Some people can try lying on the left and right, but the best position to lie is on the left. It's difficult, but that's the best place for you. So there is no correlation between how you're lying and the cord tying around the baby. Completely no connection between the two. Okay, so let's see what we have. Ask your questions. Admin, please, you can repost any question I haven't provided feedbacks on. Now, if you haven't joined the group, if you're watching me from my page in Facebook, you're my friend, you can see me. If you're in YouTube, you can see me. If you're in our page, you can see me. If you're in our group, you can see me. So this broadcast is currently live in YouTube, my timeline, my page, and the group. So those 4 groups. Meanwhile, we also have a group in Instagram. We haven't connected our Instagram. So if you're on any of the 4 platforms, you can watch and you can see us anytime we come live. Okay, so if you need to subscribe, for me to be your doctor, for me to consult with you, it's possible. You can come in for 1 week. It's called light. You can come in for 1 month. It's called basic. You can come in for 3 months. It's called classic. Or you can come in for 6 months. 6 months and 3 months are the most popular. Why? Because those 2 will give you opportunity to talk to me. So if you have a stubborn husband, I'm very, very stubborn for a good cause. If you notice, this is Match of Dimes. I represent the babies. Okay, I'm the ambassadors. I defend women. So if your husband is very stubborn, if the problem you're having in your family is because of your husband, you can come. We can be on the same side and we can defeat him. I can't remember the last time I took a husband, I didn't win. And what's the winning? Pregnancy. There are so many husbands that fought me. Who is this guy? Hey, then suddenly the wife is pregnant and he will begin to sing non-demitus. Oh, doc, you're an angel, you're this, you're that. Because they are seeing evidence. You want babies, I want babies. So our duty is to go for babies. But unfortunately, some of your husbands are very stubborn and very ignorant, and actually the people delaying you. So that when you have access to talk, we can give you a platform. Because the problem is some women, majority of women want to do the right things. In infertility, women are the most important and potent driving factor. Any woman that doesn't have a baby within 6 months is already freaking out. But most men will be drinking and going to club and be saying, don't worry, God is going to do it at his own time. You're lying, The time for a woman and the time for a man is not the same. You can still be wasting time at 92 and you can still go and impregnate a village girl. But once the woman enters menopause, that's the end of the story. So if your husband is telling, oh, don't worry, God is on the throne. Hey, we are doing this. Yes, God is on the throne. But when God is on the throne, you have to also do your part. So if you went to church today and the pastor preached the best prayer and he poured olive oil on you and he gave you handkerchief, white handkerchief, and he gave you so many Bible verses, it's good. Go and do all those things. But at the end of the day, when you go home, after eating your dinner, you make love to your partner if you're not bleeding. If you stay in guest room, and you are reading the whole Bible the whole night, and you're waiting for Angel Gabriel to come and put a baby in your belly, you're deceiving yourself. Oh. You cannot become pregnant. That your pastor that gave you all those Bible verses, that prayed everything for you, when he goes home in the night, guess what's going to happen? The wife is going to bath, they are going to eat their good food, they will be in the same bed, and they will make love. That's what people do to get babies. So don't allow anybody feed you gospel that you already know. And they use the fact that you don't have a baby to put fear in you. And the little money you have, they say, oh, come and bring money, we'll pray big prayer for you. That's not true. Look, I'm keeping it real. You have the knowledge now. Nobody should deceive you. Matter of fact, a loving church, a loving pastor can identify with people that are having problems in their church. They should have a section, a special unit of all the women, all the faithful women that have been paying their tithe, contributing to church offering. They should have a special group and identify all of them and make sure that any of them that do not have money for treatment, they raise money for them. There are so many things we've raised money for in the church. Physical project, we are building this, we are building that. And some of them are using it to go and buy big cars and big houses. Look at this is my truth. We are all Christians. If your church and your pastor is not helping you the right way, leave that church. Leave that church. Your church can contribute 1 million for you. Your church can contribute 2 million. It's not too much. There is no price tag to our babies. Our babies are what the richest thing in this world. So if you don't have the money and you're good people and you have good relatives and you have good churches, your friends can raise money for you. Your fellowship people can raise money for you. Instead of raising that offering to go and build structures that they will use to be siphoning money, they should raise money from you and encourage you to see a fertility specialist. They should stop giving you Bible verses. The problem is not the Bible verses. The problem is not praying. The problem is action. You're not making love with your partner. You don't have a fertility specialist. You're not dealing with your truths. Some of them are discouraging you from going for your IVF. Meanwhile, IVF is the only option because you're getting old. And getting old is not a crime. We are all gonna get old. So let's do the right things, my people. We cannot afford to allow people to deceive us again. I want you to be desperate, but for the right reason. If you don't have a baby and you are above 35, you don't have the liberty of time. You should have a game plan. Today is the 23rd. We have 23rd, right? So we have 31 days in May, right? How much time do you have for May? When we are done with May, what do we have? June. We've spent 6 months. What are you going to do by the end of the year? What's your scorecard? When everybody is showing up with their big belly, when everybody is showing up with their baby, what are you going to present? Have you done the job? Are you still doing what you've been doing before? Are you still taking clothing? Are you still trying to figure things out? Are you still trying to tell me what God does not do, does not exist? I believe that what God cannot do, does not exist. God can do everything, but God cannot come down and do what you need to do. Allow God to be God. Some of you can give millions to the church, but you can't take that money to go to a fertility specialist who God gave the knowledge. Prior to now, before the advent of Christianity, twin mothers are perished in the evil forest. Caesarean section, you don't even have a chance. So long as your baby is not coming through the vagina, you're likely going to die. But thankfully, God made it possible for some people to go to school, to be trained as doctors, to be trained especially so they can empower women to become mothers. Since 1974, there are so many families that lost hopes, but today the family is intact. So nothing can stop you from the love of God because the overall aim of God is to give you expected good end. Take your bold step, my sister. Look, call a family meeting. Call a family meeting. What was your target? So many people had New Year resolutions. January, I want to do this. I want to do that. What have you done? Do you have a fertility specialist? Some people don't even know what the problem is. Is it male factor? Is it female factor? What exactly is the problem? What's the game plan? The only thing, I don't have a baby. Then who have you seen? Who are you talking to? Who are your friends? What's your method? What are you doing? What's your best chance? If the group you belong to it's not making you better, then you leave. There are so many groups in Facebook, in social media, claiming to be telling you things they don't do. They just show up for the show. But you know who is telling you the truth. You know who's got your back. And if I don't tell you the truth, then I'm not being real to you, because I consider you my family. I consider you my sister. I consider you my brother. There's something I will tell you, I will tell to Chidi. I will tell to my wife. We are on the same page. You have to take bold steps. You cannot want to have twins and triplets and you're still leaning on your own understanding. No, it doesn't make sense. Okay? Okay, guys, I gave extra minutes, so I have 3 more minutes to go. So let me see. If I didn't answer your question, I apologize. And hopefully I'm going to share the transcript of this. But if you need help, please follow the admin so we can customize your care and we can see what we... Can one have vaginal delivery after fistula repair? Now, my sister, you see, we want so many things in life, but sometimes what we want might not be good for us. Now, what's fistula? Fistula means there is a poor communication. There's an abnormal, unusual communication between either the vagina and the bladder or the vagina and the anus. So you can have vesicovaginal fistula, or you can have rectovaginal fistula, abnormal connection. Ordinarily, fecal material is not supposed to be coming out from the vagina. Fecal material is not supposed to be coming out from the bladder. But when you have fistula, you have this. Now, thank God that if you had fistula, we fixed it. So when you have a pregnancy and you have fistula, my concern is not whether you're going to deliver vaginally. My concern is that you're going to get to 37 weeks and we give you elective CS. My people, you have to survive to see your baby now. Some of us cling so much on this vaginal delivery as if once you deliver vaginally, you begin to go to heaven. No, no. There are some women that are mothers today because we deliver the baby through CS. If we didn't deliver the baby through CS, they will lose the baby, they will lose their life. So my people, forget all this vaginal, this CS. They just go and present yourself to a good doctor and pray for the doctor. Please, the best people you can always pray for are your doctors. It takes a lot to show up every day. It takes a lot. The day we don't show up, we don't know who's going to have problems. So pray for your doctors. Genuinely. Stop chasing shadows. Yield. Some of the problems we have in life are man-made problems. Okay, so let's see what we have. Okay. Sucking breast increase the level of prolactin? No, it's not going to increase the level of your prolactin. Your prolactin level, when we notice is increased, we're going to check your blood. Now, any mechanical thing you do on the breast can instigate milk let down reflex, right? But that's not a criteria for knowing if your prolactin level is high or not. Okay, so it doesn't. Okay, Chinasa, you're watching from Senegal. Can excess gas in the stomach affect chances of getting pregnant? Completely no connection. There is no connection between your gas. If you have gas, we need to know why, and we need to treat it appropriately. There is no connection between your gas and your ability to become pregnant. Okay, let's see what we have. A couple of questions are going to pop up. Then I'm going to go and we're going to get ready for tomorrow. Okay. Thank you guys. Thank you guys for coming. If your questions are not answered, I apologize. It's not intentional. I've got so many things to talk about, and I gave you guys extra 15 minutes. You want to go for IVF, can you still use your eggs at age 42? So the criteria for any woman to use her eggs is the availability. So if at 42 you go for your ovarian egg reserve and we discover you have good eggs, you're going to use your good eggs. But if you don't have good eggs, we advise you to use younger eggs. So I can't stay here and say, oh, yes or no. So it's going to be based on the outcome. But please, make sure you're using a truthful doctor. Make sure you're using someone that will look you eyeball to eyeball and tell you, hey, woman at 42, unfortunately, you don't have good eggs. We're going to offer you donor eggs. Please use your donor eggs. Don't even blink. Don't even waste time. Because if you're using something that is not good, you're going to get something that is not good. In the same vein, if your partner doesn't have sperm or your partner has oligospermia, please tell your partner to yield. The only people that will know what you did to get your baby is only you and your partner and your doctor. But if you have big mouth, you can go and put it in the village church, or you can tell your mother, and your mother will be your communication minister. There are so many things your friends, some of your friends, there are so many things they did you didn't even know. Some of the people you see their baby, you don't know how they got their baby. They don't owe you explanation. You just know they have babies. There are some people that 15 years, you don't know, then they go back for Christmas, they have 4 babies. You don't have any business going to any woman and be telling, oh, did you go for IVF? Oh, did you adopt? It's none of your business. But the problem is we want to please everybody, then displease ourselves. Go and do what you need to do to start your family. Forget the society. They will be the same people that will condemn you. They will be the same people that will blame you when you don't have this baby. You do not want to look back 20 years from now and you begin to regret. No, God did not make you to be alone. Go and adopt. Adopt for a start. Okay? Can you give a woman who pissed you and went for, okay? These are the things we can discuss when you subscribe. It's not things I can attend to in this particular clinic. Guys, my time is up. Okay, my time is up. If you need to consult with me one-on-one, follow the admin, do the needful, and please, whatever they tell you to do in regards to starting your family, please do that, okay? Thank you for coming today. I appreciate you. Tomorrow, we're going to continue the clinic. Remember, every Mondays, it's for our Believing for Baby category clinic. So if you're believing God to become a mother, please show up with your questions. And by the grace of God, I'm going to tell you my truth. And you're going to imbibe your truth. And you're going to become a mother, okay? Thank you so much. If you are pregnant, don't even think of going alone. Go through A and C. Let's go through A and C. Let's join hands together and make sure that your babies are going to be fine, okay? Thank you for coming. I appreciate you guys. I love you guys. And enjoy the rest of your weekend. Bye-bye for now.